Another blow to Obamacare, meanwhile. Earlier this week, Aetna announcing that it is pulling out of nearly all of the Obamacare markets that it operates in currently. Even worse for the administration, Aetna's CEO warned that this would happen if the Justice Department blocked its merger with Humana. I want to bring in Cato Senior Research Fellow Michael Tanner on this. Michael, good to see you. Thanks so much for joining us.
Pleasure to be with you.
So basically, Aetna was warning, look, this is very expensive. This is a tough situation. We need scale. We need to get bigger. We're going to do that by merging with Humana. But if there's an issue with this deal, we're not going to be able to operate. And that's exactly how it played out. What's your take on this?
Well, I think what Aetna was saying was the fundamental truth that insurance companies, just like any other company, cannot operate at a loss. And the fact is, insurance companies are losing money on the Obamacare exchanges. We saw that earlier with United Health. And Aetna said that unless they're able to offset those losses by merging with Humana, they're not going to be able to continue. They didn't get the merger. They're not going to continue.
Yeah. So what do you think the government is expecting? I mean, these companies to just follow their policies, even if it's just going to put them, out of business?
Well, I think they're getting quite a shock at how many companies are losing money on the exchanges. I don't think that was anticipated.
Right.
Right now, we're down to about half the counties in the United States have only one insurance company offering plans on the exchanges. I mean, in Pinell County, Arizona, there's nobody offering a plan. I don't know what they're supposed to do out there.
I mean, is it fair to say, Bob Nardelli, the Affordable Care Act has been a failure?
Yeah, I think we've seen that over the years. I guess, Michael, the real question we've been talking here is who's left? You mentioned, the county in Arizona. Who's left that's really going to be able to support this?
Well, in many places, the Blues are sort of the last body standing, and in some cases it's because they're getting the favorable tax treatment in exchange for being the insurer of last resort. But the question is going to be, are they too going to start losing money? And if they do you end up with this sort of adverse selection death spiral where they offset the losses, they have to jack up premiums, that drives out healthy people out? The whole reason this thing is collapsing is because healthy people haven't been signing up for the insurance. That means you have old, sick people essentially in the insurance pool.
So, Michael, one follow-on question. Personal experience with the Blues is that if you liked your doctor, you could keep your doctor. But under this, where for example, out in California, many of the programs and policies we were used to are canceled because they're not legal under the Affordable Care Act.
Well, that's right. And Aetna's pulling out is going to mean people are going to lose their insurance yet again. In some cases, we've seen people lose their plans 2, 3, and 4 times since Obamacare went into effect. So certainly the idea that if you liked your plan, you could keep your plan is no longer operable.
Yeah, it wasn't true from the beginning, actually.
Yeah, Michael, this is a ironic and sweet lesson in irony here because the Affordable Care Act, you get worse benefits at a higher cost, and it's not working. What's funny about this, though, is that the DOJ blocked the merger on the grounds that it would actually create less competition for consumers and lead to higher costs. Didn't the Affordable Care Act do that? So what? There's just a really disconnect for me that this is ironic in every sense of the word, but we're starting to see specialty pharma is leading a lot of these costs rising higher. We're seeing specialty drugs are really expensive, and that's what's costing companies a lot of money too, as well as consumers. So is that going to continue going forward?
Well, I think that's right. Basically, what we're doing is seeing a different quality and different level of health care, and we're paying the price for it. You get what you pay for to some extent. But let's not feel too sorry for the insurance companies here. They bought into Obamacare on the idea that they were going to get all these new customers in exchange for accepting new regulations and higher premiums. It turned out they made a bad bet.
Yeah, they got customers who are extremely costly to insure. Michael, to quote the Wall Street Journal editorial page, the solution in health care to a problem caused by government is always more government. And more government creates new problems and then begets more government. What's the end game here? Is it going to be Medicare for all, a potential health insurance system nationwide that literally will bankrupt this country?
Well, that's certainly the frightening possibility because the Affordable Care Act is collapsing in upon itself and it's going to have to be changed in some way. We already know that Hillary Clinton has suggested an option to have people buy into a government-run plan, the so-called government option. And we know that Donald Trump has also said that it's the government's responsibility to insure everybody. So essentially right now, the major party presidential candidates are both in favor of some sort of government-run health care system.
Well, but Hillary said she wants to build on Obamacare, and Donald Trump said he wants to repeal and replace.
That's right, but he's also said he favors the individual mandate, and he basically has talked about the idea of a government covering everybody. So we don't know what he's actually going to replace it with.
He's talked very favorably about the need to cover everybody in the past, and he also hasn't talked at all about fixing fixing the entitlement program.
Yeah, today we also, just real quick, the Fed survey came out, and 20% of company executives are going to slash jobs because of the Affordable Care Act and its rising costs. So that came out.
And then we see the other one more regulation about if you're under $47,000 a year, you can no longer be exempt. You have to go to an hourly status. I mean, that's a new regulation put in place by year-end.
You have to get health care.
That's another regulation handed down by the Obama administration.
Yeah, exactly.
That's the overtime payroll.
Yeah.
Yes.
That's incredible.
Government is fun.
Yeah. Michael, thank you. Great to talk with you this morning, sir. Michael Tanner there. Up